Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And I'm so excited. Our Gold Tongue Tie Symposium is back. It's going to be just around the corner next month. And here with me today are two of our speakers sitting down here with me, chatting a little bit about their work and, of course, the presentation. And here are Dr. Okky Nafiriana and Dr. Ratih Wulandari. Welcome, you two.
Hi,
Hello,
Christine.
Kirsty. How are you?
Good. Oh, it's so
Thank you
lovely.
for having us.
Oh, thank you. It's so
Mhm.
lovely to have you here with me today. And we have been chatting a little bit beforehand before we did this little get together here. What I always find so lovely is that we can be from all over the world, sitting down together, learning from each other. And the two of you, tell us, where are you in the world?
Well, we live in Indonesia. It's a country in Southeast Asia.
Wonderful.
Yeah.
Wonderful. And so that's what I love talking about here at Gold is we're an international audience. We have international speakers here from all over the world, and we can learn from each other. And we're all passionate about the same topic here at Gold for the symposium. It's tongue tie. And the two of you will be presenting together. And before we talk about the presentation, I want to learn a little bit more about the two of you. The two of you work together and you are physicians. So tell us a little bit about yourself and how you ended up working together and how you became interested in the topic of tongue tie.
Okay.
Okay, you go ahead. Start
Oh,
first.
Go
I'll
ahead.
go first. Okay. Actually, at my point, it started in 2018. I will talk first about why I became the lactation counselor. Okay, Christine. Okay. Uh, when I had my first born daughter in 2018, at that time I was in my internship period, so I had the obligation to finish the internship, and then I decided to back when my daughter less than 3 months old,
Mm-hmm.
and then actually it was a difficult decision to make. And then so when I went to work, my baby got my express breast milk with bottles at home. And thankfully the internship went smooth and I could finish it within a month. After that, when I got chance to fully breastfeed my baby, she
Mm-hmm.
just got a nipple confusion, you know. She
Oh.
reject my breast.
Mm.
And then I just went to the pediatrician, an IBCLC, and then we got hospitalization to relactation for her to get breastfeeding with me again. And that time, I knew that my baby had a tongue and lip tie,
Mm.
and so she got the frenotomy.
Yeah.
And thank God, finally she could breastfeed again, and we were enjoy it. So through this journey on breastfeeding my firstborn, I just realized that uh, we can pursue on our career path
Mm-hmm.
wherever or whenever we want, but uh, our baby developments just they never come back.
Mm-hmm.
And yes, the breastfeeding process is just complete the mother and the baby.
Yeah. Yeah.
Yeah.
Well,
Uh,
go
so
ahead.
yeah. So that was the background story why I'm interested in lactation, and then I became the lactation counselor in late 2018 and worked at the hospital with Dr. Ratih
Mm-hmm.
as a team
Mm-hmm.
at 2019.
Oh, wonderful. Wonderful. Well, thank you, Dr. Okky, for sharing this very personal story with us here, because you became passionate about this through your own experience. You were even,
Yeah.
there was even hospitalization involved. And so the topic you will be presenting on must be very close to your heart as well, right?
Yeah.
Absolutely, absolutely. And now to you, Dr. Ratih, how did you end up in this field? How did you become passionate about it? And then I want to also hear the two of you, how you ended up working so tightly together that you're now also presenting together here.
Yes, well, actually, me and Okky are in a same team. There is Praborini lactation team in Indonesia, so we joined the team. I was joined the team on 2013. I have three babies, and they are breastfed. And I had difficulty in breastfeeding because they all were born with tongue ties. So I get familiar with that issue, and I had difficulty to breastfeed them because they have tongue ties and they get frenotomy. And afterwards, the breastfeeding itself is getting very lovely after they get frenotomy. So it it makes me feel that I have to become a lactation doctor and to stay in this field to make other mothers feeling the same as me and help them to breastfeed their own babies until 2 years old.
Ah, beautiful. Thank you for sharing that as well here about your journey. I question to both of you, and I start with Okky. Would you say in your training as in becoming a physician, was there a lot of training and information also on lactation and breast and chest feeding, or is that something you had to learn really after becoming a physician?
Oh, yes. Here in Indonesia, uh, no, in my university,
Mm-hmm.
there is just they tell us about breast milk is good for your baby, and it is good to the up to 2 years, and then that's it. That's just that's the information. Just it.
That's it.
They never uh, taught us about um, how to do the breastfeeding, how to do the good breastfeeding, and
Mm-hmm.
how the breastfeeding can affect the bonding from the mother and the baby. They never taught us
Mm-hmm.
about that. Yeah.
And
So
yeah,
uh,
go ahead.
after after we finish the physician, there's actually a special training the to learn more about the breastfeeding.
Mm-hmm. Mm-hmm. And was that your experience as well, Dr. Ratti?
Yes, there's not
Yes.
much information about breastfeeding during
Right.
study in university, so we have to learn it after we becoming a doctor, maybe from experience. And but nowadays in Indonesia, there are organizations that
Mm,
has developed some um, knowledge and maybe like webinar for
mm,
us in the
mm,
medical field to
Mm-hmm.
study about the breastfeeding itself.
Mm-hmm.
So
Mm-hmm.
there are much more lactivists
Yeah.
that working in breastfeeding. So we are able to gain our knowledge better now.
Oh,
yeah.
good. I'm
Mm.
glad to hear that. How high are the initial breastfeeding rates? Do you have information on those in your area?
Yes, it's around 30% to 50%, but
Mm.
um, I think that the lactivists in our country is wants to have it the rate is higher from now we have in Indonesia because
Mm-hmm.
30% is still very low. We want it to increase much more so
Yeah.
that there are many campaign in
Mm-hmm.
Indonesia through the social media like
Mm.
Facebook, Instagram, and Twitter, and so on about the breastfeeding.
Yeah.
Especially in this August is the World Breastfeeding Week, so there are
Yes.
a lot of social media campaign about the breastfeeding and to protect breastfeeding itself.
Oh, that's good to hear. I'm glad to hear that there's something in the works. Now let's talk a little bit about the presentation that you're both presenting together. The title is Clinical Case Studies, Ankyloglossia in Babies with Marasmus and Kwashiorkor. Tell us a little bit, give us a little bit of an overview. And I know, Dr. Ratih, you start off this presentation, so I ask you to give us a little of an overview what you will be speaking about, and then we go to Dr. Okky.
Okay, I will present about a case, Kwashiorkor case. So in our practice, our daily lives, we see a lot of cases, malnutrition cases, that's caused because of tongue tie. So I will present one case that affect this baby to become a kwashiorkor, which is edema all over her body. And Dr. Okky will present another case, which is marasmus. Maybe Okky will add another thing about your presentation.
Okay, as Dr. Ratih said before, it is our daily cases in our practice actually. And so just I will presentate about the one cases about a baby with the marasmus, and then we will talk about what were the treatment we gave for the babies, and then how the treatment progress, and how the treatment can help the baby to reach the good development. Yes.
Good. Well, thank you two so much here for sitting down with me and talking about the beautiful work you're doing there in your community and about the presentation. Thank you so much, Dr. Okky and Dr. Ratih.
Thank you so
Thank
much,
you,
Christine.
And for our viewers now, the presentation will be live on September 14th and is, as I mentioned, part of the Tongue Tie Symposium here at Gold of 2021. We have 2 full packed days of presentation here in September 13th and 14th for you. September 13th is all about the fundamental skills, and you get a comprehensive overview of the fundamentals, providing care to infants and young children with oral restrictions, and also how to help their families. And then on September 14th, that's the second day, it's all about advancing our understanding. It dives deeper into the complex topic of oral restrictions in infants. So you will learn about oral restrictions in the NICU and the impact of oral restrictions on the airway, trauma, timing of release, and what to do if the release does not help. And so I hope to see you all there. If you would like to find out more information about this presentation and all the other wonderful presentations in the Tongue Tie Symposium, we invite you to visit goldlearning.com. Thank you everyone for watching, and I hope to see you at the symposium. Bye-bye, everyone.
Bye.
Bye.
Bye.